So I want to thank you all for joining us for our midsummer session. There is lots to cover because we're eager for participants, all of us, to learn and to consider what you hear through the lens of your faith tradition's teachings. And most importantly, we want you to be motivated to act for justice. So as we commence our session, let us recognize and remember the Native people who were removed from the place where we presently sit. Those groups likely include the Piscataway, the Anacostank, the Pamunkey, the Mattaponian, the Nanjamike, and the Toxahents. We also recognize and remember the enslaved people of color, separated from their families and their native lands by force and made to labor under harsh conditions to build the city, the town where we are now, and much of our Northern Virginia region. I invite us all to take just a moment of silence, each through their own faith lens, for ourselves, our families, our community, our Commonwealth, our country, our world, and our planet. Thank you. The greatest impact on society cannot be made alone as individuals. The power depends on what we do next. The Interfaith Center provides a weekly newsletter called the Weekly Roundup. I encourage each of us to read it and to act as directed. It's absolutely important to stay informed. The tagline for the Interfaith Center is learn, pray, act. And we ask you to support the center with your promotion of the work that we do, to your responses to action alerts, to your participation in the center's events, and also the center, your financial resources. The center has a very exciting opportunity right now for supporters to leverage their financial support. We have just been offered a one-to-one match to significantly help the center pay off their mortgage on the office building. So without further delay, let's take the plunge. This session is about a briefing, and believe me, in a very brief amount of time, that's what we're going to get, a briefing and action. So like I used to say to my children, listen up. So we're going to invite, we're going to have 2 status reports of current activity that is happening out of the center. Our living wage certification program, and then that will be followed by plans for the center's Labor Day campaign. So Kay Francis Dolan is going to tell us about the living wage certification program.
Thanks, Anne. As many of you know, economic justice has long been one of the advocacy areas for the Virginia Interfaith Center. And a key component of economic justice is encouraging employers to pay employees a living wage and not just a minimum wage. A few years ago, the center created a living wage certification program to recognize and honor employers who pay living wages. And to help jumpstart the program in Northern Virginia, we held a canvassing session last month And we will be doing another one Saturday, July 30 in Alexandria from 10 o'clock until noon. We'll be inviting local businesses to join the living wage campaign and become certified and recognized. If you're interested, and I hope many of you are, in joining us, details on signing up to help out on July 30 are in the chat. Or you can go to the VICPP website and search Living Wage Canvas. We're very honored that Kim Bobo, VICPP's executive director, will be leading the canvassing on July 30th. And Kim reminded me that because we want to start the canvassing at 10 a.m. on Saturday the 30th, please try to arrive at the meeting point a bit early, like 9:45. When you register, you'll find out where the meeting point is, but for those of you who have pencil and paper, it will be 1319 Prince Street in Alexandria. That's the story on Living Wage campaign. And next up is Sheila Herlihy from the VICPP headquarters in Richmond to discuss the Labor Day campaign plans.
Hello all, thank you so much for being here tonight. It is very exciting to have you with us. I am talking a little bit about Labor Day. As you know, VICPP works for economic justice and works for labor rights and workers' rights. And this year we are partnering with some of our friends over at the Commonwealth Institute, one of whom you'll hear from later, to release a report on the state of working Virginia, how much it actually takes for laborers in this Commonwealth to get by, and how much of a struggle they face, many people face, whether that be the struggle to find childcare, the struggle to find affordable housing, or the struggle to get paid equitably. So this report will be coming out in the next few months, and we will be inviting you and your congregations to be a big part of releasing that to the public, and hopefully even have a chapter event and a press conference about some of our major findings. So we are very much looking forward to that, and looking forward really to engaging you and all the communities of faith in working to respect the dignity of work.
Thank you, Sheila. So the issues we are highlighting tonight, the affordable housing, the healthcare, and voting are the priority issues that the Interfaith Center is addressing in Richmond for the 2022-23 year. We're delighted to have been able to offer 3 outstanding speakers who are very well versed in their specific issues. We've posed an almost impossible task for them. Tell us in broad brush strokes the key elements of housing, healthcare, and redistricting and voting, and do so in 8 to 10 minutes. We'll facilitate your questions too, but for just a few minutes, so the clock is likely to preclude being able to answer everything. However, the organizations that our esteemed speakers hail from are listed in the chat. Check them out for a more in-depth exploration of these crucial topics. So first up is Michelle Krocker of the Northern Virginia Alliance, Affordable Housing Alliance. I'm sorry.
It's okay.
It's an organization that she founded many years ago. And so Michelle, you're up.
Thank you. And I'm going to share my screen here. And hopefully do this. Yes. All right. Can everyone see the presentation?
Yes, I can.
Okay. Let's see. Slideshow. from the beginning. Okay. Here we go. Thank you so much, Anne, for that introduction. And thank you to the Interfaith Center, the Northern Virginia chapter, for inviting me to speak about housing. As Anne said, my name is Michelle Krocker. I am the Executive Director of the Northern Virginia Affordable Housing Alliance. And I just want to take one slide to tell you who we are. NVAHA is a regional nonprofit affordable housing advocacy organization that works across multiple jurisdictions in Northern Virginia. Our mission is to promote healthy, sustainable, and equitable communities that meet the diverse housing needs of Northern Virginia residents with a real focus on the needs of low and moderate income households. We do this through public education, research, community engagement, and advocacy as tools for real systems change in our communities. And we ground our work in racial and health equity. So let's tell our story. This is affordable housing speed dating here tonight. Why do we have an affordable housing crisis? And I'm so pleased to hear that the Interfaith Center is working on a living wage initiative, because that is really one of the key drivers of what makes housing unaffordable for so many households. As you can see, wages are not keeping pace with housing costs. The census data shows us that over several decades, inflation adjusted rents rose by 64%, but real household incomes only increased by 18%. This is a national trend that plays out really in every metropolitan area of the country. The other factor that is making housing so unaffordable is that our housing supply, supply of housing for our region is not keeping up with the growth and the demand. Our older market affordable apartments and older housing stock is being demolished or renovated into high-end market housing. And we're really only replacing a small fraction of that affordable housing that we're losing. The Joint Legislative Audit and Review Commission report, the JLARC report on affordable housing in Virginia in 2021, showed us that Virginia has a shortage of 200,000 affordable homes. This has, as you can imagine, a tremendous impact on low-income households. Households are housing cost burdened if they pay more than 30% of their income for rent. But we know that in Northern Virginia, a good percentage of low and moderate income households are paying between 50 and 60% of their income for rent. As a result, we have multiple families overcrowding in one apartment. We have families living paycheck to paycheck and at risk of becoming homeless. We know, and COVID has shown us, made clear to us, that Black and Brown residents in our community have been disproportionately impacted by our housing crisis due to our historical patterns of discrimination and exclusion in our land use and zoning ordinances. They have had an inability to build wealth through home ownership, so they have been really relegated to just rental housing. In Virginia, we know that only 4 of 10 households, every 10 households who are eligible for affordable housing can find a home to rent or to purchase. There just is not enough housing supply for them at prices that are affordable to them. And I recommend Housing Forward Virginia's source book as a wonderful place for data and more analysis on these topics. So why don't we just build more housing and make some of it affordable? The cost to develop high quality affordable housing is expensive and is growing. Today in Northern Virginia, we know that total development costs for affordable housing are close to $400,000 a unit. Rising interest rates, construction supply costs, a shortage of skilled labor. We saw an exodus of labor in the 2007 Great Recession, have all contributed to these rising costs. We know that local governments provide subsidy for this development to the tune of about $125,000 per unit to keep these units, to maintain affordability, but we are struggling at this time to be able to meet that threshold, and more funding is needed. Even though we have seen an increase in housing trust funds and rental subsidies, both at the local and the state level, we are still not meeting the housing needs of our especially vulnerable populations, who are households with extremely low incomes, persons with disabilities, elderly, people on fixed incomes, or undocumented residents. What are the barriers to increasing affordable housing? And this is really my last slide, and then I'm happy to answer questions. Increasingly, we have community resistance to additional development in Northern Virginia. There's opposition to increased density and the impact that will have on traffic or existing infrastructure, especially perhaps overcrowding in schools. There is a concern about the changing character of a neighborhood and a very false perception that affordable housing will reduce real estate values in a neighborhood. There's absolutely no data that supports that false notion. There's also, sadly, just a fear and a mistrust of diverse new faces in our community. In addition to this community resistance that we do still have restrictive land use and zoning policies. We know that single family detached housing is the predominant zoning pattern in our suburban communities, and that really prohibits new, more compact housing types to be developed. I'm sure that many of you have heard about the studies for missing middle housing and how those smaller housing types, if we could build them in our existing communities, our single family detached communities, we would be able not only to increase our housing stock, but offer housing opportunities in good neighborhoods for more people in our community. So as a call to action, I ask you all to be informed, to really learn about housing challenges in your community, and to engage in these policy discussions at the local level through your faith community, your community associations, or your homeowners associations. You can testify in support of affordable housing at public hearings or write letters to the editor. Certainly, the opposition is vocal, and we need more people to come out in support and balance the conversation to elected officials who are trying to make these important policy decisions. And finally, support local and state advocacy organizations who track housing policy issues and keep you informed. So that is it for me, my speed dating on affordable housing, and I'm happy to answer any questions.
Great job, Michelle. Thank you so much for honoring the time. June is going to facilitate some questions, I think.
Okay.
Yeah, Michelle, I've got a few questions here, and I think they're all valuable questions, but I wanted to get to some that create action for us. So can you speak to about specific legislative proposals that should be supported in the next General Assembly session or in the counties, Northern Virginia counties?
Let me speak to the General Assembly session. We know that one important piece of legislation that the Governor Youngkin chose not to sign was a bipartisan piece of legislation that would penalize landlords who did not maintain livable housing standards in their apartments. There was legislation that was proposed that would give local governments some authority to penalize those landlords for really poor living standards. And it was bipartisan, and for whatever reason, the governor chose not to sign that. So I imagine that will come back before the General Assembly in the next session. There will certainly be a request to increase the funding in the State Housing Trust Fund. Governor Northam had proposed $150 million per year for the Affordable Housing Trust Fund, and that was cut in half to $75 million a year. So housing advocates will be going back and asking for more funding. I'm really heartened to hear your work on the living wage initiative. I don't know if there'll be any legislation around minimum wage or raising. I know Virginia has done some of that, but that is really the flip side of the affordable housing discussion, that people earn a wage that can help them afford housing, buy food, childcare, etc.
Okay. We have a question about if you could talk a little bit more about the missing middle in Arlington.
Sure, I'm happy to. This idea of making our zoning more flexible is a concept that is sweeping the country. It is not just here in Arlington, and it is really challenging a long-standing notion that many communities have had, that this single-family detached zoning is sacrosanct and should never be changed, and that all sorts of horrible things will happen if we loosen those zoning regulations, when in fact, if you look back in our history, we did have missing middle housing. I live in Alexandria, and I have plenty of missing middle housing on the block where I live. I have small apartment buildings, and I have duplexes right next to single family detached homes, and it has been a boon to our community. So I think Arlington has been led the region in this discussion. They've done quite a bit of study. I know that the Arlington Board of Supervisors just had spent a 3-hour work session talking about the issue of missing middle. There are recommendations that staff has put forward and that have been out for public comment. There's a considerable amount of opposition, and so we need supporters to say, yes, these modest changes of allowing duplexes, triplexes, quads in neighborhoods will not destroy the neighborhood. So
I think we have time for one more question. So how successful have local governments been in encouraging developers to provide a greater percentage of affordable housing?
That's a great question. We have most of our local governments, I think with the exception of the city of Alexandria, do have an affordable housing ordinance that requires developers, for-profit developers, to include affordable housing in their developments when they're developing their market rate housing. And that's usually done by providing density bonus to offset any loss that the developer might incur by having units that get less rent because they're serving lower income households. We could certainly do more. And so there's been proposals for different strategies to help incentivize developers to build more affordable housing. We are very fortunate in Northern Virginia that we have a very strong stable of affordable housing, nonprofit affordable housing developers whose development contributes 100% affordable housing units across the region. And we also have some very strong for-profit affordable housing developers. So those organizations are doing affordable housing units that are 100% affordable, but certainly the majority of our housing comes from our market rate developers, and getting them to include more housing in their development, it continues to be a challenge.
Thank you so much. This is great. Great to have you and the answer our questions. And now I think we're ready to move on to our next speaker.
Thank you.
Thanks, Michelle. And the broad brush strokes were broad, but I think
They
very
were.
helpful to get things moving in people's minds. Next up is Freddi Mejia, who is the healthcare expert. I hope you don't mind, Freddi, that I say that, to whom many turn for information, insight, and guidance. Freddi is with the Commonwealth Institute for Fiscal Analysis and the HAVE Coalition, and he'll tell us more about that.
Great, thank you. And thank you for having me today. I really appreciate the opportunity to speak with so many of you this evening. I'm gonna go ahead and share my screen with you all. All right, fantastic. Well, again, my name is Freddi Mejia. I am the Deputy Director of Policy at the Commonwealth Institute. We're a research and advocacy organization based in Richmond, Virginia. And we focus on policies that impact communities of color, as well as low and moderate income families in Virginia. And we focus at the state level. So as it was mentioned, I'm a bit on the time limit. And when you ask me to share what's exciting in the healthcare world in Virginia, I have so much to say, but I try to make it as short as possible here. So I have 4 items, and each of these things I feel like could be their own presentation, but I managed to get enough information on one slide each. So hopefully that will work out for folks. So I wanted to share some good news around recent updates to our healthcare policies here in Virginia, and then 3 policies at the federal and at the state level that will impact health coverage here in Virginia and really throughout the nation. So first off, maternal health outcomes has been a focus of our work since at least 2019. We know that Black women in the United States were dying at 3 times the rate as their white counterparts, and that it was such a serious issue that impacted too many families in Virginia. We know that structural and interpersonal racism has impacts on how health service is given and experienced. And to that end, we were trying to do our best in order to create some state policies that would remove at least some of the barriers to comprehensive health coverage and services for pregnant people. So I'm happy to share with folks, if they weren't already aware, that just this month, pregnant people who have coverage through Medicaid and CHIP now are insured health coverage for the year after the end of pregnancy. So before, this coverage would end after 60 days. And we know that the mental and physical impacts of pregnancy oftentimes goes much longer than 60 days. And so having access to health coverage for a full year, at least, is really important to make sure that that new families are able to access health coverage and health care services when they need it. We also, the state is also reimbursing for doula services, which is really exciting through Medicaid. Doulas are trained professionals that help people who are pregnant, help them with the process of navigating our public health system or our health system in general, and offer emotional support as well as other types of support in order to create a more calmer experience as much as you can while expecting a child, right? And that's been proven to have some really good outcomes, especially for low-income folks and as well as women of color. So doula reimbursements is a great step. And then the last good news I want to share with folks was that starting last year, all pregnant people, as long as they're income eligible, can now access prenatal care and delivery services, comprehensive prenatal care and delivery services regardless of immigration status. So prior to last year, if someone was undocumented, they were not allowed to enroll in this prenatal coverage. But now that immigration eligibility has been removed, and so as long as someone is income eligible, they have access to prenatal coverage. So that's a big deal for Virginia and for so many families here in the state. All right. The first thing I wanted to share with folks was the end of the federal public health emergency. So in 2020, the federal government passed the Families First Coronavirus Response Act, and one of the many provisions in that legislation meant that people who had Medicaid coverage did not need to be redetermined for eligibility. So typically in Virginia, every year, someone is redetermined eligibility to make sure that they are still income eligible, meet all the other criteria to remain on with Medicaid coverage. The federal government basically paused that and said that that was not necessary until the end of the federal public health emergency. So that means that for the last 2.5 years, folks have not needed to be redetermined eligible for Medicaid, which has been really great. Many folks have been enjoying continuous coverage. However, us here in Virginia, as well as everyone in the nation, are getting ready for the end of the public health emergency. The federal government has not told us exactly when it's going to end. It could end as soon as November. We anticipate that it will at least extend to January of 2023. But once it does end, it will mean that hundreds of thousands of people who have Medicaid coverage will need to be redetermined for the first time. And so many folks, especially after Medicaid expansion, they've never experienced redetermination of Medicaid. So this will be the first time that they're going through this process. So we want to make sure that state agencies and stakeholders are adequately preparing for this event, because if they do not adequately prepare, we fear that there could be mass coverage loss and an increase in uninsured rates. So we want people to have enough time to respond to communications from Virginia's Medicaid agency without being booted out of coverage. Other states already are planning some pretty insidious things around this. There's a state that hired an agency that is going to give them extra money for each person that they kick off of coverage. So thankfully, Virginia's Medicaid agency has been doing a great job with sharing the preparations and really trying to connect with a lot of stakeholders and folks that work with Medicaid populations. But that's something that we at TCI are going to continue to monitor as it develops. We want to make sure that people who are no longer eligible for Medicaid are connected to coverage, like employer coverage or ACA marketplace coverage. The end of this thing, doesn't necessarily mean a bad thing. Perhaps someone lost a job during the pandemic, and then now they have a great job and no longer qualify for Medicaid, and then they could get transitioned to their employer coverage. But we want to make sure that no one's falling through the cracks. And so what we're asking folks is to tell anyone who they think might be on Medicaid, or that are on Medicaid, to just go to coverva.org and update their contact information, because the most important thing is to make sure that everyone's aware of this new, the redeterminations are happening again in the future. So the Virginia's Medicaid agency will be in touch with those folks. We just got to make sure that they have accurate information on that. The second thing I wanted to talk about was the enhanced premium subsidies on the ACA marketplace. So again, another federal provision. In 2021, the American Rescue Plan Act was passed, and it included enhanced tax subsidies for folks who get health coverage through the ACA individual marketplace. This was a big deal. And so many people took advantage of that. There was lower out-of-pocket costs for health coverage for folks who access health coverage through ACA Marketplace. Unfortunately, those subsidies are set to expire at the end of this year. And that would cause out-of-pocket costs to rise for hundreds of thousands of people in Virginia. So there's an example down there, and I can just share one example because I know it's teeny tiny for some of you on your screens. But for example, right now, a 60-year-old couple who makes $75,000 in Virginia pays about $6,375 in premiums throughout the year. So that's for two people throughout the year, about $6,000. If these subsidies go away, the same couple would have to pay $22,900 in subsidies, in premiums rather, for the entire year. And obviously that's gonna make a lot of tough decisions for folks. The Urban Institute estimates that 39,000 people in Virginia will lose coverage and remain uninsured if these subsidies are not extended. So that's a big deal. We want to make sure that these subsidies are in place to make sure that folks have health coverage. So if you want to learn more, I suggest you go to the Center on Budget and Policy Priorities. CBPP is what they usually go by. And they have a lot of great information on that. And just let your federal representatives know how you feel about this policy. All right, and then the last thing I'm going to share with you here is the Cover All Kids program. So this is a state focused policy. And unfortunately, I think everyone on this call believes that children should have health coverage, that all children in Virginia should have some form of comprehensive health coverage. Well, unfortunately, a child's immigration status has a strong relationship with their health coverage status. So as you can see on this graph, in 2019, 4.9 of all Virginia children were uninsured. If a child is a citizen in Virginia, their uninsured rate dropped to 4.1%. If that child is a non-citizen, that means that they could be legally residing child or undocumented, their uninsured rate goes to 30%. And then finally, if a child is undocumented in Virginia, nearly half of all children who are undocumented do not have health coverage in Virginia. And that's because undocumented children are not eligible for CHIP or Medicaid. It's called FAMOUS here in Virginia, Virginia's CHIP program, but they're not eligible for coverage and they can't even buy coverage on the ACA Marketplace. So they have very limited options. 6 states and DC have created programs to offer a coverage option for this types of children. And 4 states are going to expand coverage to this population in the near future. So we're pushing for Virginia to join those states and create a state-funded option so that undocumented children can access health coverage just like everyone else here in Virginia, as long as they're income eligible. The last thing I wanted to point out here was increasing income eligibility. There's interest from advocates to ask Virginia to increase the income eligibility for children's Medicaid. Right now, only 2 states have lower income eligibility rates than Virginia. And Virginia is much too well off to be serving children at such low rates. So we're asking them to increase the rates of income eligibility so more children can access comprehensive health coverage. Just for context, Virginia offers health coverage to children at 205% of the federal poverty level. The median in the United States is 255. So we're 50% off from even hitting the median of the United States average. So I think it's about time that Virginia takes a look at this and invests in Virginia's children and their health. So with that, I would just want to thank you check out our Twitter or our Facebook at the Commonwealth Institute there, and I'll pause for questions if I have any time left.
Thank you, Freddie. I was just going to say, we have probably less than a minute for questions for Freddie, but Kay Francis was going to check to see if there was
Yes. Well, we don't have any that have been posted, but I actually have one, Freddie, which is in the General Assembly in Virginia. Are there any particular champions of extending more healthcare eligibility to kids?
That's a great question. So last year, that was the first year that this legislation was introduced, and Senator Jennifer McClellan carried that bill in the Senate, and Delegate Kathy Tran carried the bill in the House. Delegate Krizik has also been interested in this type of work, and it actually had some bipartisan support, which we're really happy about. It was ultimately not successful, otherwise we'd be talking about the success, but it's definitely something to build on, so I appreciate that question.
And I see we have one person with her hand up. Is it Gail? Go ahead. Unmute yourself.
Hello?
Go ahead. We just have about half a minute.
Oh, I just had a question because I did get in kind of late. If anyone who's participating as a presenter in this Zoom, is it okay with them to be contacted? Maybe they could come and present in my area. I am in Culpeper County.
You have the, Gail, the addresses for the websites for the organizations that these speakers represent are posted in the chat. So I would encourage you to do that. And if you want to speak with any of them.
Thank you.
About that, okay? Good.
Thank you.
All right. Well, thank you, Freddie. A lot of information and a lot of action items for us to consider. So many of you know that one of my constant drumbeats among advocates for justice is voting matters. Voting matters. In your local elections, your city council, your county boards, voting matters in Virginia and Richmond, voting matters in the US. Chris DeRosa has been immersed in the redistricting issue for years and will help us understand better, I hope, the implications that redistricting has on our vote. Chris DeRosa, you are up.
All right, let's get this show on the road. I could talk for an hour, but I think I'm going to try and keep it under 10 minutes.
Thank
you. Let's see, hold on. I want to make this screen smaller. So yes, I have been working on redistricting for several years with the League of Women Voters in Virginia. So I'm going to try and quickly go through information because voting does matter. All of these issues that people have talked about, whether it's housing or healthcare, depends on who we elect. So we need to make our voices heard. So as you know,
Okay.
Oh, hold on. So as you know, 2/3 of Virginians voted yes on the Constitution Amendment number 1 in 2020. We changed the way we did redistricting, which is done every 10 years. We wanted to end gerrymandering and we wanted to take it out of the hands of the legislatures. We did give citizens a place at the table. We did have legislators on the commission, but half of the commissioners were citizens and not politicians. So that was good. We allowed citizen participation. We required transparency. We had protections for minorities and respected communities of interest. So the commission met throughout 2021. Unfortunately, they couldn't agree on much of anything, let alone the maps. So according to the Constitution Amendment, responsibility for drawing new maps fell to the Supreme Court of Virginia, which appointed 2 special masters or experts. Those experts drew the new maps, which were approved by the Supreme Court of Virginia in December of 2021. So this is a very quick look at Virginia's new congressional districts. This is going to impact voting this year. These are what our Senate districts look like in Virginia and our 100 House of Delegates districts. So there are changes. District lines have changed. The numbers in many cases have changed. You may find candidates whose names you don't recognize on your ballot this year and in 2023. In some places, polling places have changed as well to take care of accessibility issues, split precincts, and for other reasons. And I'm not going to go into local redistricting, but that's been done in a lot of your areas as well. County council, county board, ward districts have been redrawn. So let's look at the congressional districts. These are the old ones where the current members of Congress in Virginia are serving from. They are very interesting. I think number 5 is especially interesting because it goes from the North Carolina border practically to the Potomac River. And this is what our districts look like now. You can see that they chopped that part off from District 5. Looking closely at Northern Virginia, this is the old districts, congressional districts 8, 10, and 11. I think District 11 is one of the weirdest ones and could probably go compete with the gerrymander from Massachusetts. Looks like an old man walking to me. And that old man has disappeared from the new maps. So these are congressional districts in our region. Currently, District 8 has not changed too much. It still has all of Arlington County, Alexandria City, Falls Church City, and part of Fairfax County. Then part of Fairfax County, the southwest part, is combined with Prince William County, Loudoun County, and beyond in District 10. And most of Fairfax County is in District 11. So now let's look at the state Senate maps. This is what they look like now. And so here's Alexandria City, and here's Arlington County. And most of these middle 30s are Fairfax County. So our numbers are changed. If we want to take a close-up look, on the left, you can see the district, Senate District number 31, as it's drawn currently. Senator Favola lives in that district. You can see it starts in Arlington, crosses the border into McLean, and all the way through Great Falls, and it even extends into Loudoun County. Senator Favola has to work and contact 6 precincts worth of voters in Loudoun County. So in the new map, you'll find that a lot of the boundaries of counties and cities have been recognized and respected. So Ms. Favola is now she still lives in Arlington. The new district she'll be running in, if she runs next year, is going to be district number 40. And you can see that it stops right at the Arlington-Fairfax boundary, and it includes almost all of Arlington. Part of Arlington could not be included because of population reasons. And here is the House of Delegates map for Northern Virginia. And again, looking at one district, I'm most familiar with Arlington, so I know how some of their maps look like. So this is District 48, current District 48. Rip Sullivan is the delegate for that district, and it goes from Arlington, South Arlington, again crosses the line and goes into part of Fairfax County. So what the special masters did was, respecting that county border, they established 2 new districts, one north of that line into Fairfax County. So the new District 6 is now only Fairfax County, and the new House District 1 is only Arlington. So there are changes. How do you find out if you're in a new district? So I'm going to give you 4 websites, and I will send this to you later. So don't worry if you can't copy everything down. So VICPP, Virginia Public Access Project, has fabulous information. If you go there and click on redistricting and all these sites, all you do is you plug in your home address, it'll tell you what districts you're in. Who's my legislator is on the Virginia General Assembly website. Again, if you put in your address here, click on it, you'll see your old district, your new district, who might be living in each one. It'll show you the maps as well. Now, if you want to get a deep dive and look into all the maps for the entire state or where your family or friends live, you can go to the Virginia Redistricting Commission's website, virginiaredistricting.org. You can find the Supreme Court order approving the maps. You can find links to the maps and take a look at those. And last but not least, the League of Women Voters of Virginia has their vote411.org website. Now, right now, you won't find a lot of information there. There are links to the state elections website. But once early voting starts in September, you'll find a lot of information there, what your ballot looks like, as well as questionnaires that we send to all the candidates. And what if they send us the answers, we post it there without editing. So as I finish up, we have lawsuits that you may have heard of. Now, Virginia did such a good job. We really don't have any lawsuits challenging the fairness of the maps, which I think is commendable, unlike other states such as Ohio and Alabama, who have been going through a lot of court cases. So you heard of the Goldman case. Paul Goldman requested new House of Delegates elections in 2022 based on the new maps. And he's filed this case in early 2021, but for various reasons, it was delayed and delayed. And just in the beginning of June, it was dismissed, stating he had lack of standing. In other words, he was not living in an area of Virginia where there was where he was hurt by the elections in November 2021 on old maps. But 2 days later, Jeff Thomas filed a similar lawsuit. He's been joined by current and former NAACP Loudoun presidents, Thomas and Thompson. So it's Thomas, Thomas, and Thompson against the State Board of Elections, calling for new House elections in 2022. Yes, time is short. I don't know how this will happen if they are given the ruling. We are monitoring this case and are waiting for the ruling from the District Court, Fourth Circuit Court of Appeals. So vote, vote, vote. Early voting will start September 23rd. Last day to register to vote is October 17th. However, starting this year, there is same day registration. We're not sure exactly how that's going to work, but if you have neighbors or family members or friends who forgot to register or just moved into the neighborhood, they can go on election day and sign up. Last day to request a mail-in ballot is October 28th. Don't forget that those require witness signatures this year. And election day is Tuesday, November 8th. We still have drop boxes and we still have early voting. We still have 2 Saturdays to vote, and the same ID restrictions are in place. And the League maintains great websites as well. We have a blog where we if you want to hear what happened in every single commission meeting or hearing, we have a blog for that and update on information. So this is my contact information, chris7307@gmail.com. You can call me. I'll prepare these slides in a PDF format and share that with you.
We've got one question, Chris, saying,
Okay.
Do voters in changed districts need to re-register?
No, you don't. You're already registered. What will happen, what happened here, I noticed, is my voting precinct, for example, changed for the primaries. So just before that voting took place, I got a postcard in the mail. I believe if your congressional district changed and you needed to know that before the primary, you would have received something from your local elections office as well. So no, you do not need to register again.
Thank you. That's all the questions.
Okay.
That's great. Just deep thanks to these speakers. It's 8:29. We have about 2 minutes of comments here. to share with you as we conclude. So thank you for participants for your patience with us. We tried very hard to get it all in and ready to conclude by 8:30. Here were the messages that I heard, and I hope that you did too. Number one, be informed. No, you just need to go out there and you need to find out what's happening. And we provided a slew of websites for you to be able to do that. Once you're informed, what good is it if you don't speak up? And you can speak up with your voice, you testifying, commenting. You can speak up with your writing. Send your notes, your letters, your comments to your legislators at all levels of government. You can write a letter to the editor and really speak up to the whole public, and you can be helpful in informing others about what's going on. And then the final way we speak up, you go to the ballot box and you click on the ballot, right? You vote, because your vote is your voice. And we each have an obligation. Every one of our faith traditions says that it's important to use that obligation to vote. So we have a couple of upcoming events. We've got canvassing for living wage on July 30th. We've got a Labor Day campaign, and Sheila's gonna either put in some information, or she will send you information, or go on the Virginia Interfaith Center's website and you will learn about the assistance that we're providing to the airport workers and to others. And as always, we remember that the center is a 501c3 organization. You know what that means. It needs our financial support. And it needs some suggestions for other forms of financial support. What about your congregations? Can they help? What about foundations that you might be familiar with? Can they help? What about corporations? Can they help? Michelle pointed out how many organizations are helping to build affordable housing. Well, we need help too, to encourage the kind of advocacy work that we're doing for the systemic changes. And don't forget what I mentioned at the very beginning, or for those of you who came in late, we have a one-to-one match for to leverage our financial support to help the Interfaith Center pay off the rest of their mortgage on the building. So if you're considering a significant gift, or if you're able to consider a significant gift, we encourage you to contact Kim Bobo, our executive director. We hope that tonight's program stirred your imagination, and we hope that you'll share the information that you learned. Actually, I hope that we're all annoyed enough about the lack of housing, about the inability for some people to get decent medical coverage, and for the frustration for our voters. So, that's what we're hoping, that will motivate advocates for justice to do the work that we are called to do. And remember that it's the power of we, all of us, over the power of just me individually or you individually. So it's about we doing the work of justice. So thank you for joining us. Information about the recording of this program will be available on the center's website, and we invite you to share that recording with those persons in your congregation, in your neighborhood, in your families, in your circles of friends who were unable to join us tonight. Thank you, one and all. Appreciate it. Take care. I'm going to look for your letters to the editor.